So this is what the rubber dam kit looks like. This here is a rubber dam sheet which is available in various thicknesses. I'm using a 6x6 rubber dam sheet. As you can see that the sheet has a dull surface and a glossy surface. The dam should be positioned in such a way that the dull surface faces the operator. This here is the rubber dam frame. The frame, as you can see, is curved anteriorly to follow the curvature of the jaw. This here is a rubber dam punch which is used to create holes in the sheet. Different sizes of holes can be punched depending upon the tooth to be isolated. The largest hole is for the molars and the smallest one is for the incisors. This is a template which helps you to mark the position of the tooth on the rubber dam sheet. These are the rubber dam forceps which will be used to place and remove the rubber dam retainers. These are the different types of clamps or retainers that come with the rubber dam set. There are different retainers for different teeth to be isolated. This, for example, is a retainer for a molar tooth. Now before we apply the clamp, I recommend you to attach a piece of floss around it like this. This is known as safety ligation. It gives you a chance to retrieve the retainer in case it is aspirated by the patient. Now let's start off with the placement. I'm going to operate on a 4/6, so I'm placing the template on the sheet like this and I'll mark the location. Now we use the punch and select the appropriate hole size to punch the hole. Now just to try in the retainer, we position it on the tooth with the help of the forceps. I recommend that you place the prongs lingually first and then row over to the buccal. I will then check the fit by wiggling it gently. Always make sure that the bow of the retainer is towards the distal side. Now that the fit is okay, we get the retainer out and just pass it through the hole punched into the dam. Now we engage the retainer to the forceps and we place the prongs lingually first and then move over to the buccal. We then put the frame onto the dam sheet like this. Make sure that the convex portion of the frame is facing outward. We then take an instrument and roll the dam under the prongs. I will then seal the cervical portion of the tooth with a barrier and cure it. And this is how easy it is to isolate the tooth with a rubber dam. And we can now